I'm Al Charbonneau, Executive Director of the Rhode Island Business Group on Health. Thank you for joining us in this important employer discussion, COVID-19 and chronic disease, the perfect storm, a message on why employers need to get involved. I'd like to begin by thanking our sponsors who support RIBGH's work, including this morning's discussion. I know I speak on behalf of the RIBGH board and our members when I say we are truly grateful to our platinum sponsor, Mercer, our gold sponsors, Blue Cross and Blue Shield of Rhode Island, HILB of New England, United Healthcare, Neighborhood Health Plan, Tufts Health Plan, and Aetna. Our silver sponsors, Delta Dental, Merck, Novo Nordisk, and USI Insurance Services, and our RIBGH members, a growing group of 90 or so companies representing almost 80,000 employees. I also know I speak on behalf of the board when I say thank you to the RIBGH Health and Productivity Committee that is responsible for today's event. The H&P committee is co-chaired by Robin Bouvier from Aon and Jean Tapley from Amica Insurance. I also want to thank Joanne Bolata, Erica Collins, and the staff of the Rhode Island Department of Health for organizing today's event. All bios for today's speakers will be on the RIBGH website after the event, so intros will be limited to name and position. To kick off today's discussion, we have Kelsey Tucker, Community Health Network Manager, Rhode Island Department of Health, and Jasmine Franco, Chronic Disease Program Manager, also from the Rhode Island Department of Health. Kelsey?
Thanks, Al, and thanks for having us here today. I'm going to go ahead and share my screen. Okay, so can you guys see my screen?
Yes.
Great. So as Al said, my name is Kelsey Tucker. I'm the Community Health Network Manager at the Rhode Island Department of Health, and we're going to talk to you today about the Community Health Network and the evidence-based programs that are a part of the CHN that folks in the Crush COVID Employer Challenge can earn points for getting employees interested in. So first, the Community Health Network. Some of you may have heard of it. If not, we are the centralized referral system for chronic disease evidence-based programs. And we collect the schedules from various organizations across the state that provide evidence-based community programming. And we put them all into one place so that providers or individuals or community-based organizations can just have one point of contact to get a variety of different people involved in a variety of different programs. So when we get a referral, we can get those referrals through fax or through an EHR that delivers an eFax, or sometimes it might be emails or phone calls. And when we get those, they are received by 2 trained patient navigators. So those patient navigators are bilingual. One is bilingual English-Spanish, and one is bilingual English and a few different African dialects. We also have access to a language line to be able to address the needs of any other folks that do not speak one of those languages. So the patient navigators are trained in motivational interviewing and in all of the different programs so that they can work with the patient to figure out what their needs are in terms of programming and what the barriers to attending that program might be. So if it's a scheduling issue and they work during the day, they can try to find a program that meets in the evening. In the past, transportation was a big issue, but at this point, because all of our programs are virtual, that's not a barrier that we have to consider as much anymore. You know, things like childcare could be a problem, so they'll work to try to figure out which programs are offered during a time where the participant is able to get some childcare. So once they figure out all of those contributing factors, the patient navigator will enroll that person in a program. If there's not a program available at the time, the patient navigators can get that patient on a wait list. So the Community Health Network manages wait lists for all of the different programs. And that way, as soon as, you know, if you're on a wait list for the diabetes prevention program, as soon as a new DPP class is posted, we can go through that wait list and contact every person to let them know. So once it's been sorted out where that patient is going to go, we can provide information back to the referring provider if that's who made the referral. And in that disposition, we explain whether the patient navigator was able to enroll that patient, if the patient declined to participate, they were waitlisted, or if we couldn't reach them. And that way the provider knows at least the beginning of an outcome for that patient. And we are working right now on increasing that loop, so we'll be able to provide the provider in the future with more information about attendance at the program. So as I said, we work with a variety of different partners to pull the schedules into one place. So these are all of our different partners. We are constantly looking at new programs and new partners to work with. We want to make sure that we're expanding our offerings to include as many different chronic conditions as we can and to target as many different people as we can. So these are currently all of the different folks that we work with. So I know I've talked a lot about the healthcare provider, and that is where the largest percentage of our referrals come from. But there are other sources as well. So as you can see here, we do get referrals from other healthcare entities, such as hospitals or urgent cares, emergency rooms. We also get referrals from the community action programs, West Bay CAP, EBCAP, those types of organizations. We do get a few from community health teams, and then that unknown/other bucket encompasses community-based organizations as well as self-referrals. So in addition to being able to call or email the Community Health Network as an individual, there's a website, and I'll show the link a little later, where you can go to register right online as well. So that unknown other bucket encompasses all of that. So the ways to get connected, I've touched on these. The first is our CHN referral form, and that is primarily what the providers use. However, any organizations participating in the challenge can certainly use this, as well as any organizations in general. You don't have to be a participant of the Crush COVID Challenge to make referrals into these programs. We will make sure that you have the referral form, and if you choose to use it, you can write your organization's name on the bottom of the form to get credit in the challenge. The next way, I think, is probably, the next two ways I think are probably a little bit easier for some of the employers here. You or the patient can call CHN. So you can just give us a call, let us know what program either you, the employee, are interested in, and then the patient navigators will help get you enrolled. You just want to make sure that if you're telling the employee to call us directly, that they're mentioning the challenge so that we can track that. Our patient navigators will be trying to ask everybody that calls, but we just want to make sure that we don't miss anyone. So if the employee can mention it, it's kind of a double fail safe there. And then last, you can register online. So it's the same thing as I mentioned. You go online, you register for a program. Essentially what happens is our patient navigators get a notification that somebody has expressed interest in the program, and then the patient navigator will call them just to make sure that the program that they're interested in is really the right program for them, to make sure they understand what the program is all about. So when the patient navigator calls, at that point, either the employee should mention the challenge or the patient navigator will ask, and that way you can get credit that way. And we will be tracking all of these referrals. So that's why we want to make sure that the challenge is mentioned. So these are all of the different programs that we offer. We do have, so these are the full current program list right now. Not all of these are virtual programs. So what we're going to do today is we're going to go over the virtual programming options that are eligible for points. Okay, so not this whole list, but there are select ones off this list. However, all of these are available to get employees enrolled in now or in the future. So the first program I'm going to talk about is the Diabetes Prevention Program. I think a lot of you have probably heard of this program in one capacity or another. It's really a program for adults who are medically cleared to lose weight. So the goal of the program is to reduce the risk of developing prediabetes or diabetes by engaging the participants in incremental lifestyle changes focused on healthy eating and physical activity, with weight loss being one of the ways that they track progress. So the goal is for the participants to lose 5 to 7% of their body weight during the course of the program. The program is, it does meet for 16 weeks weekly, and then they move down to continued support monthly and then bi-monthly for the remainder of the year. So it is a year-long program, but it's not every week for that whole year. As I said, it is for adults 18 and over. You do have to have a BMI that's over 25, or if you identify as Asian American, over 23. And you have to have one of the other criteria. So the other criteria, you can either have a blood test that puts you in the pre-diabetic range. You can have a clinical diagnosis of gestational diabetes during a past pregnancy, or you can have a score of 9 or more on the CDC screening test. Now that screening test essentially gives you 6 points if your BMI is over the 25. So just by taking the screening test and meeting that over 25 BMI, you're already getting 6 points. So a lot of people score or can screen in based on that screening test. Okay. The next program is our CEDO program. It's also called Diabetes Self-Management Education, or just Diabetes Education. So a CEDO is the person who delivers that one-on-one service. CEDO is a Rhode Island specific credential. It is the equivalent of the national credential, CDE, a Certified Diabetes Educator. So these folks are either nurses, pharmacists, or dietitians that are trained in diabetes education and are able to deliver one-on-one clinical education around diabetes management to people diagnosed with diabetes. So this is for people that have that diagnosis. They have to have a physician referral and they have to have insurance. So I think for most people, most employers involved in the challenge, they're probably offering insurance. So any insurance provider in the state of Rhode Island is required to cover the diabetes education, any private insurance. So everybody should be eligible based on that. With the physician referral piece, you can still make the referral directly to Community Health Network, or the employee can, and will work with them to get that physician referral. So for example, if you know that you want to refer Jasmine for diabetes education, you can go ahead and have Jasmine call the Community Health Network and say, my employer is part of the Crush COVID Challenge. I learned about the diabetes education and I want to do that. We will make that referral. We'll help them find a site. We'll make the referral to the site. And then the site is going to contact Jasmine and ask for her primary care physician's number if we don't already have it. And at that point, they will send the referral form to the primary care physician and the physician will return it. So Jasmine doesn't have to do anything else. The employer doesn't have to do anything else. So even though that piece is there and sometimes people get nervous about it, it's a pretty easy process. So now I'm going to pass it off to Jasmine to talk about the Own Your Health Collaborative and the evidence-based programs that she works on. Jasmine?
So I'm Jasmine Franco. I'm the Chronic Disease Self-Management Education Program Manager at the Department of Health. I'm going to talk to you about a few of the virtual programs that I manage in collaboration with the Own Your Health Collaborative.
Jasmine, can you speak closer to your microphone?
Yeah, sorry.
Thank
Does
you.
that sound a little bit better?
That's much better.
Okay. Kelsey, could you go to the next slide, please? So I just wanted to give you guys a brief overview of what the Own Your Health Collaborative is. You might be familiar with it if you've heard of our programs. I know Kelsey talked a bit about the partners that work with her with the Community Health Network. We are one of those partners. So the Own Your Health Collaborative consists of Department of Health, the Rhode Island Parent Information Network, the Rhode Island Geriatric Education Center, URI, as well as health-centric advisors. We were founded in 2016 to streamline our efforts in expanding access to evidence-based programs. So we use a braided funding approach to work together and cover more of the state to expand access to these programs rather than working in silos. So our mission is to empower Rhode Islanders to take charge of their health through evidence-based programs in their communities. And our vision is for Rhode Islanders to remain active, healthy, and involved members of their community as they age. So a lot of our programs, they can be geared towards older adults, but they are for everyone 18 and older, and I'll get into that in a bit. Next slide, please. So this slide here just goes over how we work together as a collaborative. So our overarching goal is to increase the access to all of our chronic disease self-management education workshops and programs, specifically in the state of Rhode Island. Like I mentioned, we all have funding from different sources, and we use that to support those goals. We conduct outreach, we schedule our workshops, we recruit and engage participants together as a unit rather than individually. And we also market and promote our workshops with the Own Your Health brand together rather than as individual organizations. You'll learn more that we do collect participant data. So for most of our programs, we have our own participant pre-survey that is before a workshop starts, a post-survey that's at the very end of the workshop, and then a 6-month follow-up that we collect and analyze ourselves with the collaborative. We do work very closely with the Community Health Network. So all of our programs, and I'll mention it again in my next coming slides, we encourage that participants are referred or registered through the Community Health Network. It helps streamline things. There's a bunch of benefits, including the patient navigator sending reminders to participants, following up with them on how they're doing. So it's beneficial to the participants as well as us for registration. And we also actively recruit for workshop facilitators and host trainings as a collaborative. So we couldn't do our workshops without our facilitators who are normally, we follow a peer model, so they can in some way, shape or form relate to the participants in the workshop, whether it's through age, through chronic condition, chronic pain, caregiving, our leaders can relate to those participants in the workshops. So we try, not in a pandemic world, but we try to host at least 1 or 2 trainings a year to build up our workforce. We also work together to build relationships with employers, healthcare providers, community-based organizations. Typically, when we're not in a pandemic, our programs have always been in person. So it's been especially important to have those relationships in place for implementation sites, to refer through the CHN, to fill our workshops. And it's just as important now that we're virtually to make sure we're reaching everyone who needs these programs. Next slide, please. Thank you. So the first workshop I'm going to talk about is Tools for Healthy Living. And I do want to preface this by saying that Tools for Healthy Living is offered in a few different formats. This one here that I'm going to go over is, this is the typical format, whether we are in person or virtual. We can offer this program for 6 weeks for 2.5 hours. 1 session per week. It's for anyone at 18 or older. It could be someone that's a caregiver, a family or friend of somebody, that either has a chronic condition or is looking to make healthier lifestyle choices and would like to be a support for them. It could be someone with a chronic condition, or it could honestly be for anyone just trying to make a healthier lifestyle for themselves. This program covers everything from nutrition to physical activity. So it could be just someone looking to learn more to improve their lifestyle. Right now, all of our programs are only offered virtually. So someone would have to have access to Zoom, which it's just the link we provide, but so they'd have to have either a laptop, a tablet, or a smartphone to join in and then be available for those sessions. So when I say the format is a little different here, what I have listed here is a special format we have offered just for virtual right now. Normally in-person workshops this workshop has to be 2.5 hours once a week for 6 weeks. There's a worksite version that we're actually hosting virtually now, and it can be hosted not for you guys, worksite. You guys are all worksite, so it works fine, but we can actually host it for other sites that aren't worksite. But the worksite version is a little more convenient as it's only 1 hour a week for either 12 weeks or 1 hour twice a week for 6 weeks. We can offer either way. If anyone took a peek at the CHN calendar, they might see a virtual format for 2.5 hours because some people do prefer that. So we still are offering the 6 week, once a week, 2.5 hours. But a lot of people prefer, especially for the worksite, the 1 hour, either 2 times a week for 6 weeks or for 12 weeks. So that's why I wanted to say there's a couple of different formats. So someone would have to commit and be available for those sessions to participate virtually. The topics that are covered here include work-life balance, fatigue, pain, isolation, which is super important right now as we're all kind of feeling a little isolated, exercise, improving strength and balance, appropriate use of medications, effective communication with family, but also with healthcare providers, physical activity, decision-making, and nutrition, if I didn't say that already. So by looking at the topics here, you can see that a lot of people could fit into this, especially with the work-life balance right now. It can be tough since a lot of us are working at home. So this is definitely one that I would suggest. You don't have to have a chronic condition. This just could be someone looking to learn more about living a healthier lifestyle. And again, you could look up our workshops on the CHN calendar or call a patient navigator. And if there's something that's not fitting for you or for your employees, we could always put them on our wait list, or we are continually scheduling workshops, so there should be something available. Next slide, please. So this is, again, another format of Tools for Healthy Living. This is called Better Choices, Better Health. This is new to us. We haven't offered this in the past, but we adopted it specifically for virtual programming. This is essentially Tools for Healthy Living, but it's completely online. It is a self-paced program. So if someone's not comfortable logging into Zoom, being on video, and they'd rather do something that they can do on their own time, Better Choices, Better Health is for them. It's the same eligibility, anyone 18 or older looking to live a healthier lifestyle, or someone that might be a caregiver. And they complete this online over 6 weeks as well. But they don't have to log in for a specific time. It's not like the workshop starts at 1. They can log in as they please and do their tasks as they see fit. It's all discussion and forum based. So it's really self-paced, and the topics are exactly the same. And again, it's Tools for Healthy Living, except being virtually or in person. It's completely online. There are still 2 leaders who facilitate and who are available for support, but we don't manage those. It's managed all through a Canary, the organization called Canary. So we help the person get registered, and then it's all kind of fit into this online package. But if they ever needed any help or had questions, of course, they could reach out to us. Next slide, please. In the chronic pain self-management program. So this was also a program we've offered for years in person, and now we're offering it virtually through Zoom. Again, it can be for anyone 18 and older, someone who's dealing with chronic pain, a caregiver or a friend or family for support, and again, who are willing to participate virtually and have access to a laptop, computer, or smartphone. This program, the format, even though it's virtual, it's a little different. This one is offered for 6 weeks, once a week for 2.5 hours, which does seem like a long period of time. But we do find in our participant data that we collect, a lot of the participants wish it was longer. They wish the 2.5 hours isn't a huge deal to them. They wish it would go beyond the 6 weeks. There are breaks built in there, so it's not like just sitting in front of your computer for 2.5 hours. We encourage, especially because it's a chronic pain class, that if sitting is disrupting your how you're feeling, get up and walk around, take a break, even if it's not a break time. We understand that it can be difficult. It's also hosted, as I didn't mention with the last program, it's also hosted by 2 peer facilitators. So they have gone through a training and are completely certified through Department of Health and the Self-Management Resource Center who has created these programs. And they are available for support and TA through the 6 weeks, as well as us as an Own Your Health Collaborative. We are here for support. I do want to mention that for all of our virtual programs, in addition to 2 peer facilitators, we do have a technical assistant liaison on every single session. So if there's any hiccups, any concerns, if anyone's having trouble, that TA is there to help the participant as well as the leaders if there's any issues the leaders have. Again, though, we send reminders, weekly reminders ourselves on top of what the Community Health Network patient navigators send. So the participants always have our email addresses from the collaborative if they ever needed more support than that. Additionally, with chronic pain and for Tools for Healthy Living, all participants will receive a free resource book that goes along with the sessions, and they also receive a relaxation CD. The difference between Tools for Healthy Living and chronic pain is that chronic pain is obviously more focused on chronic pain, whereas Tools for Healthy Living is kind of more broad. Chronic pain could be involved in those topics, but in this specific program, it is the main focus. So it touches on pain, fatigue, isolation, physical activity, which is super important. Again, effective communication and nutrition, and pacing and activity and rest, which is super important with pain. One thing I do want to mention specifically with Tools for Healthy Living and chronic pain is that there's a lot of brainstorming, and one of the biggest, probably the biggest positive parts or outcomes of these workshops are the action planning. So a lot of times when someone goes to the doctor or talking to their provider, there's a goal there. It's you need to lose 25 pounds. You need to, you don't do any physical activity. You need to work out for 150 minutes a week. Those are big goals, and sometimes they can be very overwhelming for many people. So our action planning, which they do almost every week, helps them take that goal and break it down into something attainable and achievable. And that's really when we get our feedback, that's what's super helpful to the participants, is having this big daunting goal and really being able to pick at it and get there more slowly than, how am I going to lose 25 pounds? So that's a lot of the feedback we get back, is that's a huge technique that they hadn't had before that's super helpful. Next slide, please. And finally, Walk with Ease. Some of you may be familiar with this program. It is a big one for employers. It is an evidence-based walking program. It is available for anyone 18 and older at any type of physical activity level. If someone can only walk 10 minutes a day, that's fine. It's really self-paced and truly a program that anyone can fit into. The format is that it's 6 weeks, and it encourages participants to walk 3 times a week on their own or with a buddy if they so choose, for up to 30 minutes. So again, if someone is a little less mobile, their goal might be by the end of the 6 weeks to get to 30 minutes. They could start at 10 minutes. They could start 10 minutes 3 times a day to work themselves up. It's not about your steps where a lot of walking programs are. It's more about a self goal and just getting yourself active and moving. Also with this program, there's a free resource book that has a walking tracker built right into it. There's other resources such as stretching, how to pick up appropriate walking shoes, goal setting. It's a super helpful book. The great thing about this program is we actually just created an online portal. We partnered with the University of North Carolina, and we have a portal for registration, weekly reminders, and data collection. And it is right there at the bottom of the link. And if Joanne sends these out, you guys could take a peek at it. So this is also, I don't want to be confusing about the portal, because you can still get to this and register for this through the CHN. There's just this link where the patient navigators would guide participants to, so that way they could sign up for the program, receive their free book right through there. So when someone, actually, Kelsey, are you able to click the link? I could kind of show you guys. If not, it's no big deal.
Do you see the website?
No, but that's okay, Kelsey. Don't worry about it.
Okay.
So with the portal, someone would head in there. They would put in their contact information and their address. And then within a week or two, the participant would receive their resource book and they could start the program at that point. So this is a rolling program. Kelsey could join today and I could join in 3 weeks. It's on a rolling basis. Once you register and you give them your address for your book, they'll send you a welcome email to let you know your book is going to be coming. You also go ahead and fill in your pre-survey data right there. So it's mostly demographic data and some things about their physical activity levels. And then for every week of the program, they receive an automated email to keep them motivated and walking. And at the end of the 6 weeks, they also will receive an email to go ahead and finish their post-survey. And all of that data is collected in a nice Excel spreadsheet, and we can provide that to the employers if they so choose. It is de-identified, but when the employee is on the portal, they can select that, oh, I am participating from Rhode Island Department of Health or whatever organization they are working for. And we are able to get that aggregate data for you. So we launched this around December and people are using it and loving it. And we're actually moving into Portal 2.0, which is even better and it'll be even more streamlined. Not that we haven't had any issues with Portal 1.0. It's just the next level, which we're excited. And to be honest, this is one of my favorite programs. The resource book is awesome, and it hopefully with the year we've had, it'll encourage people to get outside and keep moving, because I know for myself, I've been sitting in front of a computer and on my couch a lot more than usual. So I am a big fan of this program. There is one more program there's no slide here, but I just want to mention in case anyone is interested in. It's called the Diabetes Self-Management Program, which I know Kelsey mentioned DPP and the CEDOS and DSMES. This is a little bit different. This program is similar to the Tools for Healthy Living and Chronic Pain in that it follows a 6-week, 2.5-hour format. It was created by the same creators of that program, the Self-Management Resource Center. But that program is available. If you take a look at the CHN on the calendar, it is for those who have diabetes and want to learn more about managing it and managing their symptoms, but it's also appropriate for caregivers and family and friends who would like to learn more on how to support their family members. So if you have any questions, I could also answer those on that program as well. And I believe that's it.
Kelsey and Jasmine, there was a question that came up in the Q&A section, and it's asking, as employers are very often do not know about employees' serious health conditions, this is PHI not something we're comfortable in asking about and necessarily knowing about their employees. How are we envisioning that this is going to be handled by employers? I just want to make it clear that with the promotion of this competition, you promote the programs out to all your employees. You're not singling out anybody. And then if they choose to enroll in the program, they can be directed to the community health network via the promotional flyer or whatever else you send out to them. And the community health network people are going to ask, try and get the company name only because of the challenge. So that we can track it, but no names of those employees are going back to you or to anyone else. It's just more to track the number of people that enroll per company so that we can give you the points towards that credit. It was a way of motivating, enrollment into the programs, but we don't expect you to be singling out individuals or if you're not comfortable asking or talking to them about it, which is fine because it is PHI. The route is to just do a general, announcement that they're available like you would do any other wellness program.
Joanne, can I add something?
Sure.
Mm-hmm.
So I just wanted to add that everything Joanne said is 100% accurate. And there's also going to be, when we get to the toolkit, you'll see the list of all the different ways you can earn points. And one of those extra ways to earn points is to set up a time to meet with Jasmine and I. And we can go over, if you have more specific questions about how to market these programs or how to get people interested and how to work around the issues of PHI and confidentiality, we can definitely address that in those meetings. If you wanted to come up with some more specific ways that work within the structure that you have at your organization. So that's just one way to earn those extra points and take advantage of that meeting time that's available.
So Kelsey and Jasmine, thank you very much. By the way, we have a couple ways of asking questions. You can put it into Q&A, or at the end, we'll have an opportunity for a question. So please don't hesitate to ask. Once again, Kelsey and Jasmine, thank you. Now my pleasure to introduce Joanne Bolata, who probably is the person on the group that doesn't need any introduction, but I will do so anyway. As a board member, Joanne has made major contributions to the Rhode Island Business Group on Health, including helping bring the Crush COVID Employer Challenge to the state that it's at right now. And she's going to talk about the toolkit, which is an item that was promised by virtue of people attending the Crush COVID webinar here today. So Joanne, without further ado.
Okay, thank you, Al. I'm going to try and share my screen. Okay, can you see the toolkit?
Yes.
Okay, perfect. Before I go into the toolkit in more detail, I'm going to talk a little bit about why we're doing this challenge. And the reason we're doing this challenge is because this pandemic has had a significant impact on the Rhode Island economy and Rhode Island businesses. And many of these businesses are struggling to survive, and it may even be some of your businesses. And the reason, if we don't get ahead of this virus, as you've heard from Dr. Fauci, Dr. Jar, and many other resources that are credible, the Department of Health, right now, with these new variants coming out, we will be cycling in this forever, and it's going to have even more of a devastating impact to business and to your employees. People are dying of COVID, and it's continuing to spread, and these new variants are more contagious too. So we put this challenge together to help kind of motivate everyone again, because we've become a little COVID weary, and maybe let our guard down a little bit at the holidays and other times. And we feel that it's time now that with businesses help, because you have a great distribution mechanism within your organizations to communicate information out to your employees, to encourage them to continue to do the social distancing. And there's also some weariness from people about getting the vaccine and the safety of the vaccine. A lot of misinformation out there. So we wanted to be able to get credible information out to employees via their employer. If we all work together to do this, then I believe we can, help get out of this pandemic eventually, hopefully, within the next year, and everything can go back to normal and businesses can stay open and continue to thrive. So we tried to make this competition as easy as possible for you to compete and earn points. And the types of information that we included in this competition where you can earn points are things that you are really important right now to help people survive COVID. Chronic disease, especially diabetes, and you're going to hear from Susan Sarah. She's going to jump on around 10 o'clock to do her presentation. She's with the American Diabetes Association. But people with chronic diseases, especially those with who have diabetes and any kind of heart disease, as well as obesity, are at the highest risk of ending up in the ICU and possibly dying from COVID. And so it is mission critical right now, until we can all get vaccinated, until we can all go back to normal, that we help these people survive. And so we have introduced a lot of wonderful tools and programs here to help you communicate that out to your employees, so that they have everything they need to protect themselves against COVID. Between getting vaccinated, taking advantage of these programs. I mean, these are wonderful programs that the Department of Health is offering at either no cost or low cost out for your employees to take advantage of. And we've also, the other things, little things you can do, like the flu shot. We've included points for that. That's still very important right now too, as well as taking, for you as an employer, Providing employees with tools, and we've included choosing wisely in this competition, because choosing wisely is an initiative. If you're not familiar with it, and you're just joining the challenge and not a member of Rhode Island Business Group on Health, because if you're a member of Rhode Island Business Group on Health, you've heard me mention choosing wisely a million times. But choosing wisely is an initiative that was developed by the American Board of Internal Medicine Foundation. That's the organization that educates and board certifies our physicians and specialists. They have come up with some wonderful resource materials that will give your employees a guide to use to help them navigate and have a conversation with their doctor about treatment options and risks associated with that, costs associated with it, so they can work together to come up with a treatment plan that's right for them, but also avoid what we call low value care. And those are unnecessary tests and procedures that unfortunately in this country, there's about over $740 billion spent on unnecessary tests and procedures that can actually be harmful to you as an individual. And we want to eliminate that and better use those dollars to open up access or reduce healthcare costs in general, and hopefully your premiums over the long haul. But these materials give them a guide as to when it's appropriate to go see a physician and when it's not. Like they were developed by doctors, so they're the highest credible source of material that you can probably get right now, and they're all free and available online, and we included them in this toolkit. So all of this is why we're doing this challenge. We're giving you as much information that you can share with your employees, and we put it into this wonderful toolkit that I am now sharing with you. So in here, you will find in the toolkit, just a little introduction to talk about the toolkit and contest points. So if you wanted to know the rules in the background, you can just click in here. And I guess I should take a step back too, so that you can find it overall. If you go into ribgh.org, you'll see our homepage, and there's a button on the homepage that says Crush COVID Challenge, Learn More. If you click in there, you can get into the toolkit that way. If not, you can get in right through this Health and Productivity tab, and there's a little sidebar that says Crush COVID Employer Toolkit, and then this page will come up. And so the way we organize this is there's kind of like a little, table of contents here that tells you what features are in here. We've organized it by the rules of the challenge. We've got an introductory letter. There's a sample that you can share with your employees that you can just cut and paste and maybe modify. So it's a template. You can put your logo on it and you flip it out and connect it to your employees. And then we've organized it by, the vaccination, chronic disease prevention, flu prevention, choosing wisely, and then using the Crush COVID app that the governor had developed to do contact tracing, and then some additional resources. So I'm going to go into some of these. But if you click on here, you will get directed right to the section, so you don't have to scroll through. But you can scroll through right from the top if you so choose. So we're going to start here. And here we have the Crush COVID Challenge. And for those of you who are just joining and deciding whether or not you want to participate, you have to be an employer with 2 or more employees. You have to have an office in Rhode Island. You don't necessarily have to be based in Rhode Island to participate. You simply need to fill out the registration form. So if you scroll down, here there's I believe on the home page, when you go into the health and productivity section, there's a whole, there it is. There's a section on how you earn points, but you just scroll down to the bottom and there should be oops, I'm back in the toolkit again. The registration is in the health and productivity. It's in the Crush COVID Challenge, and you just scroll down and there's a section you can fill in with your information, click submit, and you're enrolled in the challenge. The first section that we have is encouraging employees to get vaccinated. So when you click in this section, this is information. If you do the downloadable introduction letter, you get 10 points for that. And then we connected some information about the getting vaccinated. You can get 20 points if you send out a notification to your employees encouraging them to get the vaccine. So just by doing that, that's 20 points. It gives you information from the CDC about side effects. So if you click in here, hopefully the technology gods will not fail me. Oh, here we go. It goes right into the CDC's website. It gives you links into all of their different tools. So they have a toolkit as well. So you can click into their toolkit and you can get information from essential workers, community-based organizations that will help you provide information out to your employees. So how to promote the vaccines and printable stickers, social media that you can share on there. And it's all easily accessible through this toolkit. I'm just going to click back again. All right. And the Rhode Island Department of Health has shared their timeline for when different people are eligible to get vaccinated, so that you can share that with your employees to give them a general idea of when they might be eligible to go get the vaccine. There's a little video here that they've connected from the CDC that talks about what to expect after you've gotten vaccinated, to help educate people, get them over that hump and that fear about, you know, the safety of the vaccine and getting vaccinated and what might happen afterwards. We've created all kinds of vaccination resources for you, communication toolkit for clinicians, anything for the vaccination information in general. And then we've created a chronic disease prevention management section. And this is where you'll find the information about Jasmine's programs and Kelsey's programs. If you click here, this brings you to the Rhode Island Department of Health network website for, and it goes over some of the programs here. You can click in there and have more tools available and link to this. And it gives you kind of a brief overview of some of the programs and how, you know, how the highlights of them, that this is what Kelsey and Jasmine just went over. And also they've connected a flyer. This is the email. You can connect right to them in their phone number. So if you want to get into Community Health Network, you can just copy that and send that out to your employees. There's also the PDF. So this is a virtual flyer. That you can print down or just simply, you know, take the PDF and send that out or post it to your website. And it gives a highlight of all the different programs that are available and count towards points for this challenge. And just keep clicking the back button and it'll bring you right back into the toolkit. Connected information about what to do if you have a severe allergic reaction, such as anaphylaxis or anything else. So that's, get more information on that link. The CDC information is here, like I said. And, you know, we've got in the chronic disease and prevention section, also, there's some more resource information down here. So diabetes is a flyer on diabetes prevention and the diabetes self-management program. And then we've got some great resources that Susan Sorrow, when she hops on at 10 o'clock, is going to talk about too. So this one is very interesting, this diabetes risk test. And these are all links directly into the American Diabetes Association website. So they'll, you know, be updating them and taking care of that. And I don't know why that didn't come in. Take our risk test, there it is. Might be because of my connection. But this is a nice risk test that you can link out to your employees and they can enter some information and it can tell them what their risk level is for diabetes. And it takes 60 seconds. It's a series of quick questions. I'll let Susan go into that more because it looks like my connection is taking up too much internet. See if I can get that. I have to go back out and so again, to go into to access the toolkit, you can either go into learn more from here or the health and productivity section. And I'll go in this way, and over on the right hand side, it says Crush COVID Employer Toolkit. If you go into the Crush COVID, that will bring you into where you can register for the challenge. And we'll go back into the toolkit for a minute. Okay. So we scroll back down. So we also have some information on weight management and obesity that was shared with us by several different sources, Novo Nordisk and some of the other organizations have shared. So you have Truth About Weight fact sheet, action study on obesity, a new approach to weight management. So you can click on all these different resources, and these are things you can share. There's also information about the flu prevention and key facts about the flu. So a lot of people are leery about getting the flu shot. I hear so many times talking to friends saying, oh, well, I don't want to get the flu shot because I'm going to get the flu afterwards, and not necessarily so. And, oh, it doesn't protect me, I get it anyway. So this type of information is good to share with people to maybe encourage them to get a flu shot. Choosing Wisely also has a flu shot information. And I'll see if this will come up. So these are the resources I was talking about in Choosing Wisely. They have patient-friendly materials on an array of different topics. And so this is one on colds, flu, and other respiratory illnesses in adults. And this is an important one when you want to try and avoid low-value care, because often antibiotics get prescribed for the flu when they will do absolutely nothing for you for the flu. They don't, antibiotics are not, they kill bacteria, not viruses. And so this is a great piece that talks to your employees. Let's see if I can click on the PDF. That's patient friendly. It talks to them about antibiotics and not viruses, like what a virus causes, the risks of antibiotics, why overusing them is a serious problem, and then also how to identify whether you do need antibiotics and when you don't, and when you should be contacting your doctor. So there's over 100 different pieces of material just like this on an array of different topics that the American Board of Internal Medicine Foundation has identified as opportunities for low value care or unnecessary testing procedures. So it's a great resource for you, and I highly encourage you to take advantage of these materials. And those of you, like I said, for Choosing Wisely, the core of the campaign is really starting a dialogue with your physician. And so the 5 questions are really the most important foundation of this campaign. So we've added information there, and we've also put down here some resources that the flyers that talk about the 5 questions. And the 5 questions under Choosing Wisely are: do I really need this test or procedure? What are the risks and side effects? Are there simpler, safer options? What happens if I don't do anything? Because doing anything sometimes is an option. And how much does it cost? Will my insurance pay for it? And at least gets people thinking about the cost, and then you can avoid some surprise billing. And we put all different resources. You can order the print out flyers of the 5 questions. There's rack cards, wallet cards. We have posters if you're still doing in the office at all, or when you return to the office, that you can hand out to employees or connect them with. And then the Crush COVID app, here's how you can access the Crush COVID app. Some information about it and in the purpose of the Crush COVID app. And it's really to help the contact tracers trace anybody who may, have come in contact with other people who may have been infected with COVID and come in contact with other people, to help track who they've encountered, to make it easier for the contact tracers to notify those people and get them into quarantine. And then there's some more CDC information, and we have the Rhode Island Crush COVID-19 information page. So that's pretty much the toolkit. And like I said, this is an evolving tool for you. We want to hear your feedback of what other types of information would you like to have in this central repository that would make it easier for you to help communicate to your employees and make them feel safe in their workplace, as well as help them continue to stay diligent about adhering to the CDC guidelines, social distancing, and taking care of their chronic conditions. So I'm always open to adding more information to this, whatever will help you. So you can contact me, and I will provide my information when we send out all of the flyers, all of the copies of the presentations and links to the toolkit prior to this. So that's it. And if you have any questions, we'll take them at the end of the presentation. So Al, I'm going to turn it back to you.
Well done, thank you. I put a plug in for Choosing Wisely. For those of you who don't know, there's, I think the current count is 90 or 80 companies that have rolled out Choosing Wisely to their employees. Both houses of the General Assembly have endorsed Choosing Wisely. The governor has declared the state a Choosing Wisely state. All of the insurers have adopted Choosing Wisely, as well as all of the major medical groups and the Rhode Island Medical Society. Choosing Wisely, and by the way, today's event is supported by the generous granting from the Rhode Island Foundation. So if you have a question about anything, the toolkit and or Choosing Wisely, Crush COVID, you know where to reach out to, and we'll move on from there. Is Susan with us now?
Yes, she is.
I am here. Good morning.
Susan, hello.
Hello, Al. How's it going?
Not bad
Al
for
in group.
not bad, thank you. As I said, the bios will be on the website. So it is my pleasure to introduce Susan Sarro, who's the executive director of the New England chapter. I think would be the appropriate term, the New England chapter of the American Diabetes Association. Susan?
Al, thank you so much. Let me share my screen. Folks, give me 1 second here.
Oh, that moment of sheer terror until it comes on.
I know, the sheer terror. Ah. At least we can laugh about it. Can everyone see this?
Yes.
Okay.
So,
Awesome. Okay, it should be coming through any second.
okay.
All right. I'm going to go ahead and get started. So first of all, I want to thank you for the invitation. And I want to thank all the employers that registered today. You know, one thing I think sometimes we take for granted is just all of the support that we receive through work when we're trying to live, you know, a fulfilled life. And I think not being in the workplace, finding programs like the Crush COVID Employer campaign or program is a way to kind of keep your employees connected, especially in this pandemic that we're going through. So I just wanted to thank everyone for taking the time to learn a little bit more about this. So I'm Susan Sarro, the executive director with the American Diabetes Association in New England. And you know, sometimes when I do these presentations, I feel like I'm a bit of the bearer of bad news because I'm the reality lady. And so the American Diabetes Association, you know, our mission is to cure diabetes and to prevent it. But more importantly, it's to improve the lives of folks that live with diabetes. And we don't just want people to live, we want them to thrive. You know, I have a board member who says to me, I do all I can to do anything like a normal person would do. And I think it's important that, you know, we have those types of resources and that we help people that are affected by diabetes live their best life. So why is diabetes such an alarm? And why? And we're going to talk about why and its effect and the effect on diabetes through COVID. But more than 34 million Americans actually live with diabetes. That's 10% of our population. 1 in 3 Americans have either prediabetes or full-blown diabetes. And 88 million Americans live in that prediabetes category, and many of them don't even know it. So I don't know how many people are on this call, but if we were to look at, the number of people, 1 in 3 of us would fit into some realm of diabetes. The other thing as it relates to your lives, being if you're a corporate wellness, manager or head of HR, it is expensive to have diabetes. The annual healthcare cost for a person is 2 times higher. And I don't think, as an employer, and I know as a manager, I have a couple staff that live with diabetes. And I think just understanding the stress that they have around cost and the healthcare spend, it really is for a person and for a corporation. It could go into the billions of dollars. So it's a very expensive disease. That's why organizations like the American Diabetes Association are so needed. We do a number of things. I'm going to touch on it quickly and then get to these tools and resources for you. But we really do work on increasing people's risk or helping them understand their risk. We fund innovative research. You're going to hear a little bit about some research statistics that came out of COVID that we funded recently. We work with medical professionals to help them stay up to date on our standards of care. And we also engage the community. We make sure the community knows that we're there for them and that we have the tools and resources, not only to help them, manage their chronic condition, but to find other people that are like them and they may understand them and really have a community that they can go to. One other thing I will say is many people don't realize that the American Diabetes Association has a legal advocacy arm. So on an annual basis, we try more than 2,000 cases related to people that are discriminated, be it in the workplace or, a parent that's trying to get their child into school, things like that. Other resources are, we have an information center, diabetes prevention programs, again, online community. I'm just going to move through this rather quickly. So we're going to talk a little bit about some tools and resources that you can use through the COVID Crush challenge. So first, I want to kind of let you know what's going on with COVID as it relates to diabetes. This is an article that just came out on February 1st from the Washington Post. And unfortunately, in this article, they were talking about some new statistics and information coming out for people that have gone into the hospital with COVID and have never had been predisposed, never been diagnosed. There is now data that is telling us that 14% of people that are leaving a hospital stay from COVID are leaving now with a diabetes diagnosis. So that is very concerning because many of the folks that went in had no prior, knowledge, had no, were not certain if they had some, developing problems, but to leave with a diagnosis of either type 1 or type 2 can be unsettling, especially if you've never lived with diabetes before. If you're unaware of the difference between type 1 and type 2, type 1 individuals cannot make insulin and that's needed to regulate their blood sugar. And type 2 is when a person makes too little and becomes insulin resistant, what causes their blood sugar to rise. So this article was very, very concerning because it will add to the number of people that are actually getting COVID on a daily basis. Some other things just to be aware of related to COVID. It's unfortunate, but folks that have had diabetes and have contracted COVID, 40% of the people that have died from COVID, unfortunately, has had diabetes. People living with diabetes are 6 times more likely to be hospitalized and unfortunately 12 times more likely to pass away. There are some other ancillary effects to, the COVID pandemic that now more than ever, the health equity or inequity of our country. There's just such a spotlight on it because of the number of people that are passing away in multicultural communities, in places where there's lack of access to care. There are many significant and disturbing decisions that have to be made. Like 1 in 5 people may say that they may choose between food and actually buying their medication. 12% have seen an insurance disruption, and 1 in 4 people are reporting that they are not having access right now, or there's disruption in access to healthy food. So COVID's had a really humongous effect on our world and right now. So this is my plug to ask you all to please, 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 please wear a mask. They're saying now to wear a double mask, it's even more protective, but I want to drive you to our website. It's diabetes.org backslash or forward slash coronavirus. This is where you and your company can go to find more information on the vaccine, how to be prepared, how to take precautions. If you're feeling sick and you live with diabetes or you're pre-diabetes, lots of information in here. There's also where you'll find other statements around, if I have diabetes, what should I do? Here's a little checklist of what someone with diabetes can do, to talk to their doctor about as it relates to trying to prevent, and being prepared during these days of the pandemic. The other thing you'll find is if you're looking for a vaccination guide to share with your employees that might be living with diabetes, this is just a great, little snippet that I pulled from the site. But we are recommending that people have the vaccine, and it's a really important tool, as I'm sure you've all heard, in protecting the health and safety of all of us. So if you're looking for that type of information to supplement this kind of COVID challenge, you want to visit our coronavirus section of our website. So I want to get into some tools and resources that you can use during the challenge. The first one, I heard Joanne talk about the diabetes risk test. This thing is an amazing tool. It can be used in a number of different ways. If you have an employee that hasn't gone to the doctor in a while and maybe is scared and having that conversation, they've been ignoring their health this year, maybe the last 5 years, this is a great tool that either I could take for myself, or I could take it for a loved one. If I think my mother might have diabetes or she's afraid to talk to her doctor, I can take it on behalf of her. It's a 60-second test. There are 7 simple questions. And what happens is, as soon as the person answers their 7th question and hits go, in their inbox through email, they're going to have a rating of a low, medium, or high score. And basically what happens is it's a printable document that they can take and share with their document. If you're a low risk, they're going to say, hey, keep doing what you're doing, continue to eat well, continue to, get out and get some exercise. If they're at high risk, they're going to recommend that they speak to a doctor, immediately, and also give some suggestions and next steps and to-dos. So this is just a great tool to begin that conversation or to supplement a conversation. This is available in paper copy. So Joanne, if you wanted to have me send you a PDF, I could do that. It's mobile friendly and it's web friendly. So many different ways that this could be used. And it does come in Spanish.
Oh, perfect. Yeah, we can add that to the toolkit.
Awesome. The next tool, which I think many people can relate to or understand, that, diabetes and heart disease have a lot of things in common. Many times, some of the indicators for someone that may have heart disease and diabetes are very much the same. So this is an initiative called No Diabetes by Heart. It's a collaboration with the American Diabetes Association and the American Heart Association. And this is a great place to go for tools and resources that, help the person in your workplace that, may have heard from their doctor, hey, you're at risk for getting diabetes. They're going to be like, oh my God, diabetes, like, what does that mean? So in the No Diabetes by Heart program, there are some great tools in here that supplement some of the challenge, this COVID challenge resources. This is a sheet that mirrors a little bit of the same questions that I believe are in the Choosing Wisely, resources. I just wanted to show you that, this has been a very effective tool in speaking to, your doctor with, so that can be printed out and can supplement to what is a part of the resources that we have. But No Diabetes by Heart has a lot of videos, libraries, there's a newsletter content. if you want to drill into cardiovascular disease and diabetes and understanding how it can affect one another, this is the place to go. There's more COVID resources. There's some information on kidney health. There's lots of tools and resources on exercise and food. So it's just a great place to go. And you get these wonderful kind of printed out documents. I wanted to show you a second document that I thought would supplement your, some of the, oops, sorry guys. Sorry about that. This is a conversation piece that talks about different numbers as it relates to, you hear the term A1C or my blood pressure or my cholesterol. This takes the conversation with the doctor one step further. It also is a place for someone to record their numbers. And it also teaches people, like, what's the target rate? Like, if I have diabetes, someone really should be striving to have their A1C, in that 7, 8, 9% range. But this is a great supplemental tool. When somebody gets their blood drawn for tests, this is a place that they can, talk to the doctor about as it relates to understanding their own numbers. So I'm going to move on to living with type 2. And I'll go back, in the No Diabetes by Heart program, you also will see some access to this wonderful tool. So if I'm a newly diagnosed with type 1 or really, excuse me, with type 2, this program is awesome because it's designed for helping the person that's newly diagnosed understand their condition. And it's something that you can, enroll online. It's free. And then you're sent some really great, healthy eating guides, like how to stay active. It's really a supplement to all of these tools. But one of the best things about it is you get this guide here, getting started. I've heard so many times from people that once they hear that diagnosis, it's always that question of like, now what? Living with type 2 is a program that helps you to answer the question of now what? And it keeps the person involved and engaged in the community to move them along in their journey of living with diabetes, or type 2 specifically. And this just goes into it a little bit more. There's a few resources. Where do I begin? And then also the getting started. But, I think the other thing that in this program, it does address the emotional health aspect of diabetes. There is a lot of depression and anxiety that comes with diabetes diagnosis, especially if you're someone that has to administer insulin, give yourself shots, things that are can be shocking for a person to have to do for the first time. This type of program is really there to supplement and support you through some of those new things that you'll have to do to manage your condition. There is an opportunity to get some free resources, this Where Do I Begin book. If you're interested in ordering a few free copies, I can share this also with you, Joanne, so that folks, if they do want to get some hard copies, I know everything's digital right now, but for when folks maybe do go in person, or if this is a way an employer wants to connect with someone they know that maybe lives with diabetes, and they can send it with notes, or I don't know, let them know that they're supporting them. You could offer some of these copies to be mailed out if you really wanted to. So let me move on quickly so we have this monthly Ask the Expert series. You can visit our website again. It's diabetes.org/experts. And on a monthly basis, there is an opportunity for a person to listen in on a webinar or call over the phone, because not everyone has the web capability, and listen to an expert talk about all different types of topics. Sometimes it's foot health, sometimes it's like kidney health, sometimes it's eye health. This is the chance for the lay person to talk to a professional and have direct one-on-one conversation. So I want to move to a resource that we are most frequently sought after, or looked to, I should say. The number one reason that we have been told that people come along with our science, to ask that $1 million question of what can I eat? And the Diabetes Food Hub is really that resource for the person living or trying to prevent diabetes. Our food hub is just the destination to go to. So what's great about the Food Hub is that it's designed to help teach people how to read a menu, plan their meals, grocery shop. There are more than 4,000 recipes that are rotated through this. I think they refresh 2,000 at a time, but I know we have a database of 4,000. So if someone would want to learn to cook, or let's say someone loves like Creole cuisine, but they really want to take some of the fat out of it. I mean, it teaches people how to swap out. So it's just a great resource that people can dip into, create their own account, and kind of save their recipes and information as they continue to learn about how to eat for their condition. Then I just want to drive you to our healthy living resources. And this is a new section of our website. It's a supplement, and it's the reinvention of our Diabetes Forecast magazine. We no longer are printing that magazine. We are now driving that same type of content to our healthy living resources. So what you will find in this area of our website, these 4 blocks here are the 4 most frequently, sought out pieces of information that we've kind of pulled together in this area. It's not everything, but food, physical activity and weight loss, fitness, and mental health, along with, other things you can find in here too will be information on medical devices, information on medication. It really is a one-stop shop for continuing to manage your diabetes in these different subjects. And again, I want to mention mental health, because that is a big area that people tend to ignore. And then lastly, before I wrap up, I just encourage you to join, if you ever want to get involved with the American Diabetes Association, please let me know. We do a lot in the wellness space. If you'd like me to come and participate in, if you do lunch and learns, or you want to have this conversation within your own workplace, we are happy to do that. I'd love to supplement your Crush COVID Employer Challenge activities. So let me know how we can help. We do a tour to cure where people look for a physical activity to do. We're doing it virtually in August this year. I'll share the information with Joanne. And then, we do have opportunities if your organization is looking for a cause, to rally around. We call it Team Diabetes. We do a DIY site where you could do some sort of effort to give back if diabetes is something that your organization chooses, or your employee chooses that they would want to give to. So that was a lot in 18, 20, 19 minutes, but thank you for having me. I hope these resources help shed some light and help some folks with their diabetes, or, folks that are trying to prevent. There's so much out there, and we're just happy to help you all on your journey. So thank you.
Well, thank you for doing this for us. We really appreciate. These are wonderful resources that we can certainly let people take advantage of. And it's a compliment. Your program and the Department of Health programs, between the two, you have so many tools and resources to help people that I think, by getting that message out that these are available to your workforce, for them and for your employees and for their families.
Yes, I would say that. I mean, we do have a lot, and we appreciate any individual or company that wants to share this, because it's about getting the word out. Agreed. So thank you all. And I want to thank everybody who does sign up for the challenge, and let me know if you need any help.
Excellent. Thank you, Susan.
Thank you.
We're entering the question and answer phase. We've had a couple of questions. Are there any additional questions? Well, one question that popped into my head, it strikes me, Kirsten's first question earlier in the program, it strikes me that not all employers are comfortable engaging their employees. And I'm just wondering if that's something that the H&P committee ought to be talking about, because my knowledge of the membership at the H&P committee suggests that there's a wide range of skill bases there on how to engage your employees if you want to, without getting into personal health information. And that's something maybe that we might ask the H&P committee to take a look at. What do you think, Joanne?
I think that would be great. Absolutely.
Okay.
I want to mention too, if you are considering joining the challenge, or one major benefit to you is also, it demonstrates to not only your employees, but to your customers, because we are going to be promoting the people who have the companies that have enrolled in this challenge, you know, in the media and any other opportunity to promote it. It gives you a spotlight to send a message showing that you know, take safety and your employees held seriously, and that you're a great place to work, that you also have a safe environment for your customers. And so it's a great way to promote your business, especially at a time right now when we're all kind of struggling to you know, stay afloat. So I hope that you would consider and pass the news around and try and help us recruit as many people as possible. I know we said that today's the deadline, but in reality, you have until May 31st to earn the points. How you earn those points are up on the RIVGH website under the Crush COVID Employer Toolkit. And, you know, I just encourage everybody to join and get others to join too. And definitely take advantage of the toolkit.
So thank you. You know what? We have the opportunity to give you a few minutes back to your day. So let me just take a moment to thank Kelsey, Jasmine, Susan, and Joanne for their great presentations. I want to also thank the Rhode Island Foundation for its support of the Crush COVID enterprise, or the Crush COVID opportunity, as well as the Rhode Island Department of Health. So if there are no further questions, thank you for joining us today. We really appreciate your attendance. Thank you.